Greetings, everyone. My name is Larry Cole. I am host of COVID Impact 360 Conversations. Today, I have Doc Roy, our Chief Science Officer at COVID Impact 360. This is a continuing series of questions that we had from a video we did about 2 months ago that was the history of COVID and SARS-CoV-2. And from that particular video, we got a number of really good questions. So this is the last question that we had from that series, and I'm going to go ahead and read it. And then I'm going to pass it back over to Roy, and we're going to get some good answers out of this. So, Roy, good morning. Um,
Morning, Larry.
so this is from Jane R. Her question was, I recently read that the WHO has said that the real number of COVID-19 deaths was 20 or 21 million globally. Is this true? And what explains it if it is true? Could you please explain this to me? I would really appreciate it. Thank you very much, Doctor. And I'm going to pass it over to you because that's a great question.
Yeah, and it's one that I'm sure several people are looking for an answer to because they've heard this as well. So, Jane, great question, and yes, you're correct. You read that from the WHO. The World Health Organization has now put out the same numbers at least three times since the fall of last year, right up to the beginning of this year. In one of the latest statements from uh, the head of the WHO, it was included that they're estimating that the global deaths so far are at least 20 to 21 million. And the reason for that discrepancy from the 7 million that you always read and the 880,000 likely infections is that those all come from official statistics that most countries in the world complied with and sent into the WHO, where they were tabulated and then they populated all of the coronavirus dashboards that everybody could go look at every day and see what was happening in their country and all around the world. Well, when we started to reopen the world again in early 2021 to mid 2021, we had just moved into the fifth variant of concern, Omicron. BA.1, BA.2, and BA.4 and 5 were still pretty nasty, and they were causing a lot of illness, hospitalizations, and deaths. But then they started making multiple variants of concern. And as that started to happen, we noticed a trend towards a milder disease, but not mild. So the infections kept coming, the number of hospitalizations kept coming, even the deaths kept coming. But as we opened, the world made a grand decision then, we don't have the personnel, the time, or the money to keep this entire process running again, because it takes an awful lot of people to collect all of that data, to centralize it, send it to the WHO, or any country that has a CDC or a public health agency, where it then all gets sorted out and then sent on to the WHO that can be added to the list. And so that's hugely labor intensive. So essentially, by, let's say, May to June of 2022, most of the countries in the world weren't counting anymore. The people that they had doing contact tracing, the people they had doing testing, all of that started to be wound down. And even though we were still in the middle of a pandemic, it was decided that it was time that the amount of productivity lost to the pandemic of our lifetimes up to that time could not be sustained. And so all businesses and operations around the world had to go back to normal. Pretty reasonable. But understand that the virus didn't get the message, and it never stopped. So it kept spreading, it kept changing, even throughout all of those years. So all the way through the end of 2022, 2023, 2024, and right up till now, the virus is still coming, or into a winter surge in the northern hemisphere around the world. So the virus really hasn't gone anywhere. The really big difference is we're not keeping score anymore. And there's also another large reason why the number of that's reported when we stop counting, 7 million, is 3 times higher in the WHO's reports. It's because they're looking at and using a mathematical model to look at excess deaths. So you take all of the deaths in the 5 years to the start of the pandemic, so 5 year from 2016 to 2020, and then you look at the 5 years of the pandemic, and you'll find, and it's consistent with every pandemic, we always have a lot of excess deaths during a pandemic. That's what happens. So you end up with lots of deaths. But excess deaths have to be sorted out into, did these people die from other diseases than SARS-CoV-2 and COVID-19? Of course they did. So it takes an awful lot of modeling and study to go through this. And there are actually 4 other groups out there who published papers on the same issue and went through this exercise in much more detail. And they looked at either the paper or the electronic medical records of each of the patients in these excess deaths. So there was a lot more deaths after the pandemic than happened in the previous 5 years. And when they did that and then matched those to the death certificates for those patients, then we could get an idea of which ones were likely linked to COVID-19. So that includes COVID-19 direct deaths and COVID-19 associated deaths. And a COVID-19 associated death means you're in the hospital likely for COVID or for something else, but your cause of death is a heart attack, or your lungs stop working, or both. So you have cardiopulmonary failure. Now that's what would be on the death certificate, but also all the contributing factors to that death would be on the death certificate as well. And that's where the WHO's numbers came from, and from these 4 published papers that all were published in late 2024. Now they came up with a bit of a higher number. They all came up with an average of around 35 million deaths. But understand that while this is a likely real number, so it's exactly 5 times what the number we had calculated up to, early 2022, that many different countries around the world throughout the pandemic did not necessarily report regularly to the WHO. Some countries, if you think of countries in Africa and Asia and Latin America, in the rural areas of the world, it's really hard to get accurate statistics there, because many of the health facilities, may just be run by a nurse, and the nurse doesn't know how to fill out the death certificate, so she just sends the information to the capital city. So all of these factors come into play. And so you have to determine out of that whole pool of excess deaths, which ones are normal deaths. So deaths that people would have had from heart attacks, strokes, lung disease, kidney disease, you name it. They're all on the list. People who, had cancer, they're all going to keep dying. So those excess deaths includes everybody, including the COVID direct deaths and the COVID associated deaths. So when you add those all up and you match them with the death certificate, then you can count them as one or other of those. So a direct death or a COVID associated death. And both of those should be counted as COVID, because a COVID associated death means COVID precipitated your death earlier than would have happened otherwise. So that's why it gets counted. And that's where they come up with those large numbers of, 35 million. But also understand that that is also a significant undercount, partly for the reasons I just described. When you're trying to add up things in rural areas that just are very resource limited and they don't have the healthcare infrastructure, you're never going to get accurate numbers. You're never really going to know the true numbers from very rural areas, mostly in the developing nations of the world, around 100 countries or so out of the 194 recognized by the UN. So these are helpful for us to try and understand the true scope of the pandemic and also understand how it's still affecting people today. So it's an attempt to try and get a handle on what really happened over the last 5 years. How many people did it really affect? How did it affect them? What did they die of? And it just goes hand in hand with all of the other things we're studying, like the number of people with long COVID, and it helps us to prepare for future infectious disease outbreaks and pandemics so that we can always refine the system. But you're never going to get a number that's 100% correct. Some of the countries in the world never report. So think about North Korea. Virtually no numbers came out of Myanmar because they're in the middle of a conflict. Many other countries chose to report numbers that suited them for, let's say, potentially political reasons only, that the numbers aren't necessarily accurate. And by that, I mean, if you take a look at a country's population and all of the countries around it have the same number of deaths from COVID, and the country in the middle who's reporting 1/10 of those cases and 1/10 of those deaths doesn't make any sense. And it's unlikely to be true that, viruses don't understand borders. So they are likely choosing for their own reasons why they're not going to, put out those numbers. And I think you can imagine several scenarios as to why a country might want to do that. But we've had a real help in this, in that 5 countries in the world never stopped collecting the data at all. They're still collecting it to this day across their entire country. And it helps to give us a kind of a roadmap of what happened to the rest of the world. So that when we're reviewing these excess deaths, then we have something to compare it against. And so at the end of the day, is the WHO's mathematical model correct? Probably not. It's probably undercounted.